molluscum contagiosum, which is also...
Woo!
Do we do makeup down there? What are we doing?
Bruh, like, is there one model where, like, nataka kama hii?
Like, I think in school we just have, like, those Raphael Tuju videos. I'm honest.
The mouth is for eating.
And eating alone.
We use this for dental procedures. Is this what you people are using?
Skin to skin contact hivi. Ni hivi kama hivi tumekana Gladwell hivi. Ama is it like in the, you know...
Hello, Spacers. Welcome to yet another episode of Space Yako the podcast. I am your host, Gladwell. With me in studio today is a very gorgeous lady, as you can see, who's our guest for the day. Her name is Dr. Kristina Sule, and I'll just give her an opportunity to introduce herself further. Welcome to our Space Yako the podcast. This is your safe space for any kinds of conversations. Do feel free.
Awesome. Thank you so much for having me. My name is Dr. Kristina Sule, and I'm a consultant obstetrician and a general and cosmetic gynecologist at Alora Medical Practice.
Wow. Wow. Can you see her, guys? Very beautiful. So we have our hosts too.
Hi guys, Nature Shiko.
Hello, I'm Marlene.
Yes, and we are going to have a topic of discussion today, which is sexually transmitted infections or STDs. And we're just going to touch base on the overview of STIs, how to mitigate them, the kinds of effects that they do have on people. And we may have maybe further episodes to deal with the same. So if you're watching us from YouTube, kindly subscribe, share, leave a comment at Space Yako the podcast. And if you want to follow us on our website, it's Wazi, that is WAZZI.ke. So before we even dive in, we usually have a Space Pie segment.
Yes.
A Space Pie segment for this episode, and Aisha is taking us through that.
Okay, so let me find it. It's somewhere here. Did you know that some sexually transmitted infections, that is STIs, can be spread through non-sexual means? For example, herpes can be transmitted through kissing or sharing personal items like toothbrushes or utensils as well. This means that good hygiene and personal item sharing habits are also important in preventing the spread of STIs.
Wow, interesting.
Yeah. Doctor, is that true?
That is true.
Yeah.
It's not actually just from kissing and hugging and sharing place, but also just skin to skin contact. You don't actually have to be having sex, but from skin to skin contact, you can get things like herpes. You can also get HPV, human papilloma virus, which causes cervical cancer and genital warts. Yeah, so just from skin to skin contact. We also have an infection called molluscum contagiosum, which is also an STI.
Can we pull up selector?
Yeah, so all those skin to skin contact, you can get that.
What is
have
that?
to be skin. Molluscum, it's an infection. It's the name of the bacteria. It's molluscum contagiosum. Okay. Yeah. So and the name should tell you that, contact. You can get, it's contagious.
It sounds like those, what we normally say, like phantasmagogia.
Yeah. Before we get into the conversation, you've mentioned something, and I'm really curious. I picked up on that. You've said you're a cosmetic gyna.
Yes, I'm a cosmetic gynecologist. Yeah.
Do we do makeup down there? What are we doing?
I wish. No. Basically, I do handle women who get pregnant and deliver. We handle things like fibroids, hysterectomies, reproductive health cancers. However, for cosmetic gynecology, basically we're looking at genital aesthetics and function. So women who have sexual dysfunction, women who don't like the way their vulva looks, maybe their labia are too long, or maybe they had many big babies and then they got vaginal laxity and now they want tightening, whether it's surgical or non-surgical, women who have dryness, women who have had FGM and require reconstruction. So that's the work that I do.
Oh, that is beautiful.
Yeah.
Wow.
So I help women have better sex.
Wait. So when you're talking about, for example, those who have had babies and then they need retightening, ni zile story tunasikianga unamwaga coke the lemon, just for clarity.
No.
Yeah.
Basically, what we do is we do treatments like radio frequency treatment. Radio frequency is not radiotherapy, by the way. It's like a heat energy that brings the walls of the vagina together. Or we can just do a surgery. Like if it's honestly just like, say, too loose, we can cut off a section and bring it back together. Or maybe someone who had some traumatic injury or FGM, it's basically reconstruction. So the non-surgical ways are not necessarily chemicalized. They're still thermal energy, like studied upon radio frequency energy, laser energy, things like that. Yeah.
Oh, beautiful.
So that means it's women who've given birth normally.
Not necessarily. Even women who have cesarean sections can have vaginal laxity because of the hormones. Yes. So it's not necessarily. And also sometimes women just want to do it because they want better sensitivity in the vagina. They haven't even had babies, but they just want to improve their sex life, or sometimes they want to change things up because maybe they've had FGM and now they don't have any sensitivity. You don't have to have had a baby vaginally to be eligible
To
for the
reach out
services.
for
Yeah.
it.
Yeah, absolutely.
You
Wow.
said about vaginal aesthetics.
Yes.
Bruh, like, is there one model where, like, nataka kama
Yeah,
hii?
inafanana.
Like in order, like, is that, do you have, unaona kama vile kinyozi kuna kwanga na zile iwe
No, Ivy. Stylo. No. No. It's, I get that question a lot, and I've had patients who
Like,
come with
nataka
a
number 6.
photo. They're like, I want it
Yeah.
like this. No, ideally, so it's optimizing what's best for you to make your aesthetics look the best.
Yeah.
I try my best not to make it like somebody else.
Yeah.
There's no blueprint. Like
Yeah.
this is the way it should look, or this is the best. It's just to make it best for you, for your function and for your needs. So no, we don't do that. We do a
Hakuna
before and
SI
after.
unit.
No, but there's no like chart and then you're like
Big
this
deal.
one.
7.
Wow.
You see, like that one haircut kwa kinyozi ile ya ludicrous. They're like, this one.
Exactly, the
Like,
ludicrous
come on,
one. Yeah,
exact.
no,
Yeah.
unfortunately, yeah.
Wow. That's a lovely debrief on what Dr. Kristina Sule does.
Yeah.
Very mind-blowing things, very, very amazing. So we shall start on our topic of discussion for today. What is an STI? An STI or an STD? What is the definition? From that, I recall through my either primary education, we were taught so early about STIs. So it's basically a sexually transmitted infection or a sexually transmitted disease. Sindio?
Yeah.
So basically from that term, most of us will tend to think any misconception yetu tuna debunk, because Dr. Kristina Sule has said si lazima iwe through sexual contact. Amesema skin to skin contact, kuna zenye ni orally na tutajua ni gani hizo. So because we have already defined what STIs are, ningependa tupeane some examples of the STIs that y'all have heard of, zenye mnajua, zenye mmesikia in school or in like forums dealing with sexually reproductive health rights and everything else.
Kisonono. Kisonono is not gonorrhea, right?
Same Kiswahili
Bruh.
unanipoteza.
So gonorrhea, syphilis, HPV, HIV. Yeah.
Marlene, kuna yetu tumesahau?
Genital what?
That's
Yeah,
HPV.
genital.
Oh, it's the something. Okay, yeah.
There's
It's the same
crabs.
as what? Pardon?
HPV.
Oh,
HPV
HPV.
causes HPV is the virus that causes genital warts.
There's crabs, which is lice. Lice,
Lice, okay.
right?
Crabs.
Yeah. They call it pubic lice.
I don't know if
Lice.
I don't know if
Sorry.
pubic lice is the same as
As
crabs. I'm not
crabs.
sure, but yes, pubic lice is one of them.
Yeah.
I guess you could call it an STI.
We could also check on Wazi, our
Yeah.
chatbot, to confirm
Yeah.
haya maneno ambayo Aisha anatuambia leo.
No, because I remember I saw pubic lice, and then they drew like the crab in it. So I'm assuming that's what people call crabs.
Yeah,
Yeah.
I guess so.
Yeah.
There is also, is it trichomoniasis
Yes.
or what's that pronunciation?
Trichomoniasis.
That
Yes,
one.
absolutely.
So
yeah.
kwa hizi STIs,
Yeah.
basically they're caused by different things. Kuna
Yeah.
some that are caused by bacteria, right? Maybe viruses and what else?
Can I first, before you get to that,
Yeah.
when is it an infection and when is it a disease? A disease and infection is the same thing.
No.
It's not the same thing. Ideally, when you have the infection, you can, test positive clinically. But when you actually have the symptoms, you have the disease. Yeah. So, for example, something like herpes, you can get the infection, but not necessarily have the symptoms. But when you start getting the ulcers, the genital ulcers, now you have the disease. Yeah,
Okay.
Yeah,
Wow.
that's the difference. Yeah.
What are genital ulcers?
So herpes specifically can cause something called genital ulcers, so can syphilis. Basically, it's like your skin gets eaten through by the virus and it gets exposed. So you get like a little place that has pus coming out of it. It's raw, it's red, it's very painful. Actually, just looks like what you would call an ulcer. So herpes can cause blisters or ulcers in the genital area, and that's specifically a virus per se.
Does it happen within, if at all it's a lady, within
It
the
can
vagina
happen,
or just
it can happen on the
exterior?
vulva or inside the vagina. And by the way, you guys missed out a really, really important STI, chlamydia. Chlamydia.
I think it's Swahili Kisonono. Is it the
Biggest
gonorrhea
one.
or
I think it's gonorrhea. Yeah, I think it's
Okay.
gonorrhea. So
Yeah,
chlamydia
chlamydia
is
is
a
one of
really
them.
big one. Yeah.
Wow.
Yeah.
So yeah, we were saying the causes of these STIs, and
Yeah.
we said that there's some that are caused by bacteria, others viruses, others what else? I think there were about
Mostly it's
4.
bacteria and
It's bacteria and
viruses. Yeah.
viruses.
Yeah.
Okay. So I know that this isn't the first time that you're hearing about sexually transmitted infections. So what are the kinds of stories that you all have had in your, like, maybe during your childhood when you're growing up? Ni stories gani mmesikia kuhusu hizi STIs, and how different are they from what you know as at now? Like, yeah. Maybe we could hear from you, Daktari.
First of all, I'm really happy to hear that you guys are mentioning actual STIs because every time I get a patient in the clinic, especially someone who's a little bit younger, and I'm like, have you ever been treated for an STI? They're like, yeah, nimepata UTI kadha. And I'm like, no. Those are completely two separate things because the urinary tract is your kidneys, your bladder, your urethra.
Yeah.
You can have an infection in your urinary tract that's not an STI. STIs are sexually transmitted infections. So most of the time in women, they're going to have like a vaginal discharge or something like that. So those two are very separate. But to answer your question, when I was growing up, I think in school we just have like those Rafael Tuju videos.
Let me tell you, last year I told them about it, like how they used to come to. You remember, you guys didn't believe me. Aki, imagine niliwaambia vile walikuwa nakuja na hizo chats
Yeah,
and the
to scare the
videos.
life out of you, basically. And also in uni, actually, like we'd get videos and pictures and stuff like that of people like on their deathbeds because they have an STI. And I mean, it's an approach. It's called aversion therapy. You look at it, you get scared, you never want to do it, but it's not the right way to approach things. And of course, things are very different right now. Right now, it's important to understand you can have an STI that has no symptoms at all. You can have an STI that does have, that is scary, that has symptoms. And just the approach is, I think, more open because it's also more common and people talk about it right now.
Yeah.
Like, last year we were all talking about super gonorrhea and everybody was talking about it. And it's common to talk about it. It's no longer taboo. It's no longer something that you need to be shamed into discussing. So I feel like for me that the fact that approach has changed is a good thing.
Yeah. And
Compared to when I was a child.
True. There are a lot of spaces where somebody can tap and get to know more information about it. People can reach out to gynecologists as yourself for consultation.
Yeah.
So let's say the space right now is better for such conversations.
Yes. Yeah.
For me, when I was young, I knew once you get an STI, maybe the only STI at the time that I knew was HIV and AIDS. I knew you were doomed
You're
to
gonna
die. You're just dead. And then I'd consider you as a very immoral human being. Because, I mean, you're having HIV. And then I didn't understand that all those concepts are, maybe you can get HIV through breastfeeding, or during childbirth like such things. I only associated it with sex purely. So if you have HIV, I'm like, you're a very immoral person. I don't want to get close to you. And I mean, I was young, but then when I grew up, I mean, it changed. And we also had the same kinds of pictures ambazo tulikuwa tunaonyesha by our teachers pale. Kwamba if you do this, you're going to look like this. And then some horrific kifoto is over there, unaonyesha, and then you're just so scared.
Yeah.
You won't even deal with such. You won't even try to experiment. Unajua kuna zile unaambiwa usijaribu, then due to curiosity you're like, maybe it doesn't talk for you, but I'll try it. Nijue. Hiyo utajaribu. Hiyo utajaribu. I don't know if my experience is the same as yours or you.
Yeah, I feel like back then there was a lot of stigma. Yeah. So because there were no open conversations as well. And to the point that, it's later on in my life where now I can seek like gyna services. Because sababu unajua from a very young age you've been scared away from any conversation about sex, about the STIs, STDs, and to in hizo photos and we all remember, So even like later on, just for your own sexual reproductive health, ile tu kukua tu basi na gyna unaenda unaangaliwa kama uko sawa. It's something that occurred to me like way later on. Yet it's something very help, important. You get, huh? Yeah, so I feel like there's less stigma now, and more knowledge now, and more open conversations. Yeah.
So in the event that I go get tested and I find out that I do have an STI, and I probably have to live with it because there's some STIs that have no cure, right? And there's some that are definitely treatable. How will you advise somebody to live with an STI?
Well, it depends on the STI itself. For example, if it's HIV, then living with it is completely different from living with something like HPV, for example. With HIV, you have to know your status, you have to know your partner's status, you have to, lead a healthy life, take care of your nutrition, take care of your stress levels, take care of your immunity, make sure you take your ARVs, and just live a better life. Think about reinfection, so basically have safe sex, because you can't reinfect yourself with your partner. If your partner is positive, you also have to think about how you can have children if you do want to have children, because just because you have HIV doesn't mean you can't choose to have a baby. Whether you and your partner both have HIV or whether you're a discordant couple, you need to start considering such things. So living with HIV is completely different. Also dealing with the stigma, getting support, both social support, like mental support, just like dealing with the people around you and how society perceives you is very different. Now, for things like bacterial infections, for example, like if you had chlamydia, I wouldn't say you necessarily have to live with it, but I'd say for women specifically, because they tend to be the ones who show the symptoms as opposed to men who can sometimes be carriers without symptoms. Women can be asymptomatic or show symptoms. So if they do show symptoms, basically seek help from your gyna immediately. If you have an abnormal discharge, don't ignore it, because certain STIs can cause later issues like infertility, ectopic pregnancy. They can actually cause even neurological issues. Did you know that?
Really?
Yes, and PID, exactly, pelvic inflammatory disease. You can have a nervous system problem from an STI, like syphilis in its very late stages can affect your central nervous system and give you a neurological problem, or even a cardiac problem, like your heart can start to fail if you have severe syphilis that goes untreated. So it's very important to listen to your body. If you have an abnormal discharge, deal with it, because the bacterial ones can actually be treated to completion and resolve. And the reason why you shouldn't ignore is because of now the long-term effects like, infertility, ectopic, and the rest.
If you can tell us, or you can name them, what is an STI? Which STIs or STDs are curable, and which ones are just manageable?
So the bacterial ones are curable with antibiotics most of the time. The viruses, everybody knows viruses don't have a cure. You can manage them if your body is of good immunity, meaning you don't have any chronic illnesses, you don't have, HIV, diabetes, you're not immunocompromised, your immunity is good, you're young, your immunity is good, your body can actually clear off the virus on its own, maybe with some help through some antiviral medications or creams. Like if you have herpes, you can have an antiviral cream or an antiviral tablet. If you have HPV, your body can actually clear it. You can come today, have HPV, and if it's not a very aggressive variant, you can come back in a few months and find your body has managed to get rid of it. But the bacterial ones can be treated with an antibiotic. That being said, there are some that always stay in our body, like herpes. It's very difficult to get rid of it, even if the skin lesion disappears and the ulcer disappears because you are treated. untreated, it remains in our nervous system basically for life. And every time our immunity drops, it comes back to the skin, the mouth, the vulva, the penis, wherever it's going to come when your immunity drops. Yeah.
I mean it.
Yeah.
That's a lot of wisdom flowing. I mean, I'm taking some time to digest the information. That's a lot that you've said. And I feel like I have several questions still stemming from that revelation that you've simply made here.
Yeah.
I heard you say it can affect your nervous system.
Yeah.
So there is something I'm going to tell you, then you'll just correct me because I don't know if whatever I'm saying is even factual.
Yeah.
Yeah, I may be wrong. So I am aware, is it syphilis that, I don't know, it's at the base of your spine, hence let me say the bacteria. You've said that's a bacteria. So the bacteria can go through your mucous membrane and then, no, I'm not talking about syphilis. I'm actually talking about any STI that is transmitted orally. Because I feel like we've not even touched on STIs that may be transmitted orally. For instance, herpes. I'm sure there is oral herpes,
Yes.
yeah? And yeah, so there was that bit of it can seep through your mucous membrane and then it can go into your nervous system and then you are able to transmit it to someone else, say by kissing. Like, how true is that? Or it's just a
So, yes,
far-fetched view?
Anybody who has oral sex can transmit an STI orally, all right? It doesn't even have to go through your mucous membranes. Things like chlamydia, you can have a throat infection for chlamydia without even having symptoms, by the way. So, ideally, you would not transmit it to the other person. You can transmit it by kissing. You can transmit it through oral sex. It doesn't have to even go into your nervous system. So I wouldn't say that it goes through your mucous membrane into your nervous system and then is transmissible. Most of the time when you get nervous system disease, it's usually, especially for syphilis, it's usually late stage disease. For herpes, it's always in your nervous system and that's the reason why in the vulva the ulcers are so painful because they're actually in the nerves that innervate your vulva. And for people who have severe immunocompromise, like you have HIV or you have diabetes, you can get like herpes that manifests itself as shingles. So you get patches on the sides of your ribs and back. Distributed in the way the nerves innervate your chest and back. So basically you're getting herpes that's following the path of the nerve of the side of the ribs and the back. So that means it's in your nervous system. So if you've ever heard of shingles, it's like really severe herpes for people who mostly are immunocompromised, and it follows the nerve pattern on your body. So it can be on the way the nerves innervate, it follows that path. Yeah, so it's not necessarily mucous membrane to nervous system, back out, then now you give it to someone through kissing. But yes, oral transmission is possible for anybody who has oral sex or kisses.
Yeah. You also mentioned something about people with STIs trying to have a baby.
Yes.
So let me ask in the sense that we're not even talking about HIV at this point. For somebody who probably has syphilis and the partner also has, say, syphilis, are they still able to engage in sexual intercourse and probably get a child, even though they still have that, I don't know, that pain and that, is it canker they saw that they normally have that manifests itself physically on their genital organs? Is it possible or you have to wait until you fully heal for you to actually engage in intercourse?
So the question that you're asking, funnily enough, is not even a medical question. It's a social question. And I ask myself that question all the time. One time I got a person who had really, really, really bad herpes. And I was working in Kenyatta at that time, and she walks in and she can actually barely walk because she's being carried. And so as she's carried, she's put on, I'm asking her, okay, so what happened? And she's like, I'm in so much pain, I can barely walk. And of course, when I examine her, there's herpes everywhere, like all the way down to her thighs, her vulva, everywhere. So I asked her, how long has this been? Because this looks like you've suffered for many months. And she's like, no, actually, my husband noticed it yesterday when we were having sex. And I was like, how are you having sex? Like, how are you even managing? Because the pain is really just excruciating. So the question that you're asking, yes, it is possible. You would be in loads of pain, but the right thing to do would be to have it treated to completion, retest so that both you and your partner don't have it, and then you can consider having a baby.
Okay, so how do you bring about? Yes.
Oh,
Madeline.
yeah.
Let's-
You've touched on something really, really important because I think most of the times, like you said, okay, not you said, but again, you'll re-emphasize on this if it's correct, but men are carriers, and for women, we are receivers most of the times. And the symptoms might not show. So what is the importance of partner testing? Because most of the times, I might have a boyfriend and then I notice something is wrong down there. I go get treated, come back, and then get reinfected over and over. So what is like the importance of partner testing?
It's really important, but you see, the problem with STIs is sometimes they bring about a lot of stigma and a lot of problems in the relationship, and there are no statistics that tell us how many people actually end up having conflict in the relationship because of an STI, or even breaking up because of an STI. So sometimes when I'll tell you, I need you to have your partner tested, it becomes an issue. The person refuses, he doesn't want to go to a gynecologist, it becomes a whole issue. So what doctors tend to do is we do something called empirical partner treatment. As soon as you come diagnosed with an STI, I give you treatment for yourself and for your partner, because he may not have the symptoms. He may refuse to come to be tested, but the best I can do is to just give you the medication for you and your partner. But once again, that depends on whether you have an STI or not. For example, if you come in with a yeast infection, I don't have to treat your partner. It's not sexually transmitted. It's just you having low immunity and then you have a yeast infection. But if you truly have an STI, meaning I've done a test, I'll even show you, like on my phone yesterday, I just had a patient who had chlamydia, so I took a picture because I knew I was coming for this. So you have to treat the partner. Like I have to treat you and I have to treat your partner. That's the best that you can do. That being said, partner testing is really important for the partners who do comply. You know, you can go to your gyna and say, my gyna says you need to be tested, and your partner actually agrees. But the interesting thing, and I was talking to a patient about this the other day, is like, sometimes a partner will tell you, oh yeah, I've been tested. I had the urine test and all that is okay and I'm clean. But a urine test is not an STI test for a man. Yes. They need to actually have an intraurethral swab. They need to have a consultation with a urologist. That's basically the male equivalent for a gyna. Basically, the woman goes to a gynecologist, a man should go to a urologist. And it's usually an intraurethral swab or a blood test. You can't just do a urine test and say like, I'm okay. That's a urinalysis. That's a urine test. That's not an STI test. And a lot of guys say, oh yeah, my urine was tested. If they literally sat down, because women have to go through a vaginal swab, which is actually very uncomfortable. So men have to go through a swab in their penis to be able to see, do you actually have, or if they have a discharge, then a swab of the discharge can be taken. Because men with severe STIs get a discharge as well, a penile discharge, that is. So partner testing is very important. But in the case where there is reluctance, then at least empirical treatment is important, just for the doctor to treat your partner.
I have a question. So by the time, unajua for us wanawake, discharge are quite common, right?
Yeah.
Lakini by the time inafika stage in a man, yenye akona discharge, how severe is that?
It's severe. Because men generally tend to be carriers. They can have symptoms, but by the time a man has discharge, it's usually severe. Yeah.
Then
Or an ulcer even, because they can also have herpes ulcers as well.
Also, the ulcers is for both.
Men,
for everyone.
yes, for both men and women,
And what are the stats? Kwa sababu umemention tu jana ulikuwa na patient ambaye alikuwa na chlamydia. So niulize, stats zinakaa vipi? Like, is it gonorrhea, chlamydia, syphilis? Nini inatumbua huko Nairobi sana sana?
It's really difficult to answer because for me to give you good stats, you have to do a study. And a study has to be reliable, which means I can't tell you, I saw 2 patients yesterday with chlamydia and say everyone in Nairobi has chlamydia. Again, you have to do like good testing. You have to do several people.
Research.
And unfortunately, our CDC is not
Doesn't offer.
as great as maybe the ones abroad. They can literally tell you, like WHO released results saying about 138 million between 2020 to date got chlamydia as adults. They're able to give us those figures. In Kenya, we're not able to give those figures very much. But in my clinic, I can tell you the majority is chlamydia.
So that is a common STI?
Yes, that is a very common STI. Chlamydia and HPV, those two. Yeah, chlamydia and HPV.
HPV is the one that is not treatable, but it's manageable.
Yes.
HPV is the human papilloma
Yes,
virus.
the one that causes the warts
Yeah.
and cervical cancer. And actually, something really interesting to tell you guys is
Yeah.
that there's a new, well, not really new, but it's been on the market for a little bit. There's a treatment that's an intravaginal gel that you can insert into the vagina if you have HPV, and it actually helps the body to get rid of HPV. So as much as it's a virus and it's not full treatment for the virus, if you have an abnormal pap smear that's a low-grade abnormality, or if you have just HPV infection and your pap smear is normal, you can use this gel for 6 months and it helps your body actually get rid of HPV.
Is it gotten rid of fully? Like there is no trace of the HPV in your body?
It can be, but remember, it's not a guarantee. The treatment may work or may not work. So you have the choice as a patient to have the treatment
gel.
and see to help your body get rid of the virus, or you can let your body get rid of the virus on its own, especially if it's a minor infection, meaning a low-grade abnormality in your pap smear, or maybe it's a high-risk subtype of HPV that you have, but it's not very aggressive. If your pap smear is normal, many times, or if your pap smear has a low-grade abnormality, your doctor will tell you, let's observe for about 6 months and let's retest. So you have the option of either observing or actually using the gel and coming back in 6 months, and your chances of having cleared it are higher than just, kind of doing nothing about it. So it's a new treatment and it's fabulous. I like to use it for my patients
What's
as
it
well.
called again?
It's called Papillocare.
Papillocare.
Yeah,
Papillocare.
It's not
It's
an
a gel.
ad. Yes, it's not an ad, but it's a really good treatment that I like to use. Yeah.
Thank you. Now back to whatever Marlene had asked about partner testing. I'd like to know how we are supposed to like bridge that conversation to your partner in order to try and convince them to go for the testing with you. Because at this point, we shall not overlook the fact that not everyone stays with one sexual partner.
Yeah.
Some people are not even in exclusive official relationships.
Yeah.
So this is a person that you just meet maybe once in a while, and you come and discover that you probably do have an STI, and you're not even quite sure which partner gave you the STI, and you're trying to help yourself, and you're also trying to probably help the partner that probably gave you the STI. So how are you supposed to like bridge the conversation and try convince the person maybe you should consider coming with me to a gyna or to get treatment for the same?
Yeah, that's a really difficult conversation to have, whether you're in an exclusive relationship, an open relationship, a marriage, regardless, it's a difficult conversation to have. For me, I think it helps to have the conversation as you're getting into the relationship, at the very beginning, not when things are left now and you have an STI and now everyone is looking at each other in a very accusatory way.
Yeah.
I think it's important just to lay out the ground rules and say, look, this is how we want to go about it, whether you want to have protection, whether you want to, like, will we be going for testing? Do you want us to go for testing before we actually engage in sex? Do you want to have it after? And if any of us is found with an STI, how will we go about it? Because in the thick of things, everyone's emotions are heightened. Everyone is just like, oh my God, what did you give me? Who have you been with? Have you been stepping out? What is going on? My gynecologist has said this. I've had people drag their boyfriends in and go like, I will tell you what you told me. And I'm like, okay, I don't know what's happening between you guys socially. I don't even know if it's an exclusive relationship. There's absolutely no judgment. If it's not, all I want to do is just treat you. But I feel like the conversation is best approached on the onset, just like laying out the ground rules. I think it makes it easier.
So conversations revolving around sex ought to be addressed from the onset.
Yeah.
Do
Even
not
before
wait
sex.
Even before the sex.
Yeah.
That is important. I hope you all are taking notes. Take away that huge
That
point,
first
bombastic point, at shuddering point home. So yeah, basically, we've talked so much about how you get the STIs. So I'm like, can we now dive into how you can prevent yourself from getting the STIs? What are the modes? Okay, I do know that there are barriers. You can use a condom to prevent yourself from getting an STI. So what other methods are there that we can use to prevent ourselves from getting STIs?
Honestly, condoms are the biggest way to go. They're the ones that protect us against STIs, because there's very little that we can do beyond condoms. Abstinence. I like that nobody even thinks about it. It's really sad because abstain is one of the ways. But yeah, condoms, vaccines. HPV has a vaccine, so that's a big way. And like we have about 15 subtypes of HPV that cause cervical cancer. We call them high-risk variants. The same way COVID had variants. And the same way COVID had some, we call them subtypes. So COVID had some that were a bit more aggressive than others. Same for HPV. It has some that are more aggressive than others. In fact, it has 2 subtypes that are responsible for about 70% of the cases of cervical cancer. They're called subtype 16 and 18. So we have about 3 to 4 vaccines that are available on the market. One protects you against those 2 very aggressive subtypes. The other one protects you against 4. The other one protects you against 6. And the last one, which is, I like to call it the Rolls Royce of the HPV vaccine, it protects you against 9. It's called Gardasil 9. So you can have different kinds of protection. Now, if you take the 2, ideally the efficacy of the vaccine works really well under the age of 26. After the age of 26, the efficacy of the vaccine starts to drop. So the vaccination has to be done between 9 and 26, but you can still be vaccinated after 26 with eligibility from your OBGYN. So your OBGYN probably want to test you for HPV, because if you test positive, I can't vaccinate a person for something that they already have. They have to clear it from their body, then get vaccinated. So ideally, the efficacy of the vaccine will drop after 26, but there are OBGYNs who will vaccinate you after 26 because there's still some immunity that you can receive from a vaccine after 26, especially if you test negative for the virus that you're going to be vaccinated against. And so the difference in the vaccine lies in how many variants they cover and the costs. So the major ways of preventing STIs, especially for those 2, I would say is condom use and vaccination.
Yeah, interestingly.
There's something I saw. Sasa turudi kule nyuma kwa oral sex. There's something I saw, and it says they're called dental dams. Tell us more about it.
Okay, so dental dams are basically
Sorry, is it jams or dams?
Dams.
A dam.
Okay.
Dam, like Nairobi dam.
Yes.
So basically it's kind of like a condom for the mouth. I'm gonna call it that. That's the best way I can describe it. So basically you use it for having oral sex, not to have STIs. I mean, the concept to me is a little bit strange, but maybe I am biased. But basically, you either you put it on when you're having oral sex.
Okay.
So some people complain, they're like, oh, sensation is not the same. But I'm like, well, with condom, sensation isn't the same as well. So if you really want to be, extra and all that, then you can use an oral dam. It's
Can I
condom
ask?
for oral
You said you put it on where?
So
on the teeth, on the tongue,
in the mouth. You put it on in the mouth. Yes. You
like
put it on the
wear
mouth.
It's like a condom.
You wear
wear
it, It's like a kind of like a paper bag almost inside the. It's so funny because I asked.
Flexible.
Yes, a little bit. I asked a dentist about it, and he's like, "Oh my God, we use this for dental procedures. Is this what you people are using this stuff for?" Yes. And so, and like, in the West, it's very common. People use oral dams. I just feel like, is it ever that serious?
Bruh.
Like, must you? Like, is
So innovative huko nje.
I feel like. If you're going to have oral sex, just go get tested. Let everyone get tested, and then do it. Because I feel like that's taking it kind of a step further. But that being said, there are couples who, for example, discordant couples, they might find it, useful, so that they don't reinfect themselves. If you already know that you have an infection, then it's a good way to go.
It reminded me of that
There's no
common
judgment,
meme.
but I feel like it's a lot of work.
Do you know that, guys? Do you know that common meme for the mouth is for eating
and eating alone?
and eating alone, not for oral sex?
Yeah, I was almost asking if that is also used for CJ. Anyway, no, don't say that. So I want to ask. You've gone into prevention. I want to ask about managing. We know gynas are quite expensive. And even those who are affordable, some people are just shy to walk in. And what are some of the symptoms that people tend to ignore? The way you've mentioned, like the vaginal discharge. I know there is like the pimples. So what are these symptoms that people tend to ignore? And maybe when you're responding to that, how do you manage yourself in preventing, and also after maybe suspecting that there's something going on, how do you manage that situation?
So ideally, you should never ignore a symptom. And for women, I think we're conditioned to persevere and to ignore very many things. I don't know why society kind of just like pushes us towards that direction. So basically what you need to do is always pay attention to the discharge that you're having. Sometimes people don't know what's normal and what's not.
It's
Yeah.
true.
Yeah, so you're like, okay, is this normal? Is what I'm experiencing? No. So anything that's itchy, has a burning sensation, has a strange smell, has a strange color, green, black, has blood in it, that's unusual. Now, if your discharge is what is usually your regular color, but it's more than usual, sometimes that's not an issue. Sometimes you probably just have more estrogen in that phase of the cycle than progesterone. And if you find it a little bit thicker than usual, then maybe you have a bit more progesterone in that part of the cycle than usual. So in terms of consistency, that's not usually a huge indicator, but in terms of color, smell, and then the feel, like if there's a burning sensation or an itch, that's definitely something that you need to address. If there's a painful ulcer, surely you should not be ignoring it. You should be going to see a doctor. You don't have to see a gynecologist specifically for it, or a private gynecologist for that matter. You can see a public gynecologist or a gynecologist who works in a public hospital. It'll be much cheaper, and honestly, they are equally qualified sometimes, if not better. They're really good doctors. I feel like our Kenyan system has kind of made us feel like private doctors are better. They're not actually always better. They'll give you a more personalized service. They'll give you more time. You probably won't find a huge crowd in their clinic. But at the same time, in terms of qualification, our qualifications are similar. So when you go to a public hospital, you will wait longer. The facilities may not be as pleasant as you would like in a private clinic, but you will get helped. And that's
Privacy.
yes. And that is the most important thing. The fact that you will get treatment, your partner will get treatment, and that you will see a qualified doctor. So I think that's basically is what the approach should be. And also if it were to happen, between you and your partner, it happens. It's just to have an open discussion, to be able to be honest about it. And even as you see your doctor, just to be able to say, look, this is something that's affecting us. Could this be something from previous partners? Is it something that's happening now? It's a difficult discussion to have, because sometimes a couple comes in and they test positive for chlamydia. And I know that this is something that has happened in the last 3 weeks. Now they know between themselves what has been going on in the last 3 weeks, So ideally, it's very difficult for me to say, because they're like, did he give it to me? Like, I'm not your pastor, but also I'm not able to answer that question because I was not with you. I'm not here to judge or give you religious or relationship guidance. I can only say what I'm seeing and how to treat it, where it could possibly have come from, and kind of rough timeline. So the most important approach is just the honesty and being able to discuss it honestly, which is why if it had been discussed before, it would have been much easier. A lot of people in Nairobi are not actually in exclusive relationships, and that's the truth of the matter.
And even those in exclusive,
and
still not in exclusive.
Yeah, so I'm just gonna say, would you call that exclusive though?
No,
it's not. So a majority of people in Nairobi are not in exclusive relationships. So I feel like those discussions must be had very early.
You've said something really interesting. I didn't know that you could tell the time span that somebody had.
Roughly,
You
not for all. For
Okay.
HPV, you can't. Because from the time you get infected with HPV to the time your pap smear becomes abnormal is a 5 to 15 year process. So I can't tell which partner and at what point. But for things that have happened like right now, like chlamydia, gonorrhea, it's usually less than a month.
So from this time span, can you be able to know who caught it first?
How would you even know who's been with who?
Wow. So it's
Okay.
wow.
Si labda hii inaonyesha sako liko hivi na hii sako liko hivi.
I mean, there's one person who always knows. There's one person amongst the doctor and each partner that knows.
Can
right?
one person's STI be worse than the other? Then you know that this one got it before this other person.
No. When a test is positive, it's positive. There's no very positive,
Hakuna-
little
like
positive, medium positive.
Even if you
Positive.
look at them physically and you see that this person has a lot of sores and there's so many.
Sometimes you can have one sore that's been there for a month. Sometimes you can have one sore that came 3 days ago.
Okay.
You can't tell.
Talk to me about carriers.
I mean, carriers are basically people who are unwell. If you test them, they'll test positive, but they don't have any symptoms, which means that they are able to actively transmit.
Goodness.
Yes.
Is
And
it
that's
a
majority of men.
It's difficult to tell because very few men actually get tested.
yeah.
A woman can also be a carrier, by the
carrier.
way. Yeah, because if you have chlamydia and you have no symptoms, you're a carrier.
Okay.
Yes.
Okay.
Yes.
Okay.
It's not just always men who are carriers. Like
I've
I feel
always
like people
thought it's
blame.
men.
No,
Yeah.
a woman can be a carrier as well. Yeah.
So a woman can be
Yeah.
a carrier.
Carrier.
Men,
as well.
men will not necessarily show all the symptoms because
Yeah.
they don't have a cervix, they don't have a vagina.
Yeah.
By the time they're having discharge, it's a really late stage disease. But and that's the reason why everyone's like, oh, men are carriers, but a woman can be a carrier. You can have chlamydia. For example, if you have chlamydia and you don't have symptoms and you give it to someone else, you're a carrier.
True. So are there any other STIs that despite the use of the barrier, despite the use of that condom, you will still get that STI? And which are they?
HPV and herpes.
HPV and
and
herpes.
molluscum contagiosum.
Okay, mostly because they are also orally transmitted and skin to skin.
Exactly.
Are there some that are transmitted through blood contact or something of the
Yes,
sort?
absolutely.
If so, how does that process exactly happen? Is it that if I touch you at a place that you have an open wound and there is still blood, like your wound isn't fully healed, and I also have an open wound, is that blood to blood contact, or is it during blood transfusion, or how exactly
So
does
it's
it happen?
generally through blood and bodily fluids. Sometimes it can be saliva, sometimes it can be urine, it can be anything. It doesn't have to be blood to blood. It's even a person handling another person's blood. So most of the time we really worry about medics for this. And that's the reason why medics have to be vaccinated, specifically against things like hepatitis B and C, because those ones just contact with any bodily fluids, especially a person who handles them frequently in the lab, or somebody
yeah.
who sees patients who may be having hepatitis B or C, you can actually get infected.
So we are
it doesn't have
also-
to be blood to blood, or you can even get it through a blood transfusion, which is why when people donate blood in hospitals, it has to be
screened.
screened.
Tested,
Yeah, it has to be screened for hepatitis,
Yeah.
HIV, and all that. Because if you get transfused, you can get,
can.
even without ever having met the person,
Yeah.
you can get it.
Okay.
Sasa pale kwa skin to skin contact hivi ni hivi kama hivi tumekana glado hivi ama is it like in the
You have to
during
be naked.
yeah during sex
So sometimes it's during sex, sometimes it's just direct contact. Yes.
direct is like this now
Yes, like for example, if someone has like herpes on their hand or in their vulva and I
Okay.
touch their vulva with my bare hands, I can get it. Because you
okay.
never know. Sometimes you can have microabrasions on your skin.
yeah.
Sometimes you can't quite tell because we can't look at our skin in completions. There might be a breakage in the skin somewhere, and sometimes even intact skin. Yeah. So sometimes it's people who are having sex. Where there's skin to skin contact. Sometimes they're not having penetrative sex, but there's skin to skin contact. You know, sex is a very wide range of things. It's not just yes. So if
many
you're having skin
activities.
to skin contact, it
Yeah.
can actually also be. So for me in the clinic, it's very important that I put on my gloves when I'm examining a patient who has herpes, because I can actually contract it on my hands as well if I have a microabrasion or anything. Yeah. And then of course depending on your own immunity, so your immunity might fight it off,
ukweli.
but if my immunity is down,
low,
you can
you
get
get
it.
it.
Yeah.
very true
I think I just took it as literal as it is, skin to skin. So I was even assuming if I shake your hand like this.
No, it shouldn't be. You should
I
at
have
least
it.
have a lesion somewhere. Okay. Yeah, you should at least have a
okay
lesion somewhere.
thank you for
Wow.
that clarification
Thank you for that. I also did.
So someone can still use a condom.
And you can
And get
still
HPV
Oh,
and get worse.
Lord.
Yeah.
Oh my God. So this
It's crazy.
conversation is something
Yeah.
that is
Condom
so
use
extensive.
does really prevent majority of that,
Yeah.
honestly.
Penetrative wise.
Yeah.
Not even that. Like honestly, it even helps because the thing is, yes, penetrative wise, but of course you cannot prevent all the skin to skin contact, even
Yeah.
if there was condom use. But and the reason why I am insisting on this is because many people say, okay, if the condom is not gonna prevent it, then why am I using the condom?
Yeah.
You get,
Sure.
but that's because it's going to prevent very many other things.
Yeah.
And it's going to prevent the penetrative section of it. So it's just literally the skin to skin, which may be a very small percentage. Yeah.
Where exactly do people get tested for the STIs? Are you supposed to just go to, say, a health facility, to a gynecologist, or do they have like self care kits or something that you can just go purchase and just do the test for yourself at your own kind of confidential space?
Yes, they're available, mostly in the West, self-test kits.
Okay.
Nairobi, not so much. I wouldn't also recommend people to have self-test kits because sometimes people's understanding of what a self-test is wrong. Maybe they'll be sampling themselves wrongly. Then you go say, you're fine, you're negative for this illness, and yet you're the one who sampled yourself wrongly or tested yourself wrongly. So what I would recommend is people go and actually see a doctor to be able to have themselves tested. Whichever. In the West, they also have STI clinics. Other than the self-test kit. So that would also be a way to go. But ideally, see your doctor.
See your doctor.
Kuna kuangana this very common STI panel. What does it consist of? Okay, watu ambao hawajui tueleze ni nini, alafu huwa what does it cover exactly?
Right.
Yeah.
So in my clinic, because every doctor has a different STI panel, there are tests that you can just do over a swab, and they're called like a high vaginal swab. That just tells us if you have some bacteria here and there. But then now, if you're doing an STI panel, you're actually testing for specific tests. So for me, I'll do a chlamydia test, a gonorrhea test, a trichomonas test, something called Mycoplasma vaginalis. That's another kind of STI. And then we'll do a syphilis and a HIV test. So for me, that's what a panel is. And anything in addition, we'll still do the high vaginal swab. It may not be an STI, but it might be an infection. And usually, especially if you do chlamydia and gonorrhea testing, it's important to have a test called a NAT test, NAAT. So many people go like, oh yeah, I did a swab. Yes, you did a swab. Yes, it told us that there is bacteria, that there's pus, but it never told us which exact bacteria do you have. Do you have chlamydia or do you have gonorrhea? Do you have trichomonas or do you have mycoplasma? That's very important for people to understand.
Is that the same test that they do culture and sensitivity?
Culture and sensitivity now is the swab, but the culture and sensitivity for STIs, doesn't tell us the exact bacteria that you have. It just tells us, yes, there's an infection, there's excess pus cells. Culture and sensitivity is more important for a high vaginal swab or for a urine test. But a culture and sensitivity will not tell us whether you have chlamydia. It can't tell us whether you have mycoplasma specifically. You need to test for each of those
STI
individuals.
panel.
Yes, individually.
I thought the nuts, it was now the STI testing for the men, like these nuts.
No. NAAT, not nuts.
I also thought
sorry, I know that's how it sounds, and a lot of my patients say that immediately. And I'm like, I want to stop saying this word.
Okay. So probably to our audience, if you feel like you still have a lot of questions that you probably need to get more light shed upon, you can use our Wazi chatbot, and you can find it on our website. That is www.wazi, which is WAZZI.ke. Or you can go see your doctor. And for today, we do have Dr. Kristina Sule from Alora Medical Practice. Yeah, we'll still give her an opportunity to shout out her social media platforms, if at all she does have some, so that you can go connect or like reach out in case of anything. So I just need us to say any takeaway that you have gotten from this episode. For me, the takeaway from this episode is that we shouldn't use the scare tactics in order to push information regarding STIs. We shouldn't tell people mostly about the risks inakaa hivi, and you're just scaring people. Instead, we should just package the information in the way that we are showing people that you can get treated. There's some preventive kinds of methods, and you can go see a doctor and you're not doomed to die. Yes. Anyone else with any takeaway?
My takeaway. Aisha, this is
Wacha kuniangalia.
hey, in a shortcut. But anyway, throughout this episode, I've been like, where? So I in an escape route. But anyway, it's very important to just go for checkup.
Yeah.
Because you never know if you're a carrier. You might think everything is okay, but there's a problem somewhere. So it's just important to go for a checkup.
My lord. I wonder. Bruh, have these conversations. Get the right information. Nenda pale ufanyiwe STI panel test, all right? It's very important. I think once a year, Dr. Ama?
It depends on your lifestyle.
Okay.
The number of sexual partners you have, whether you're having protected sex or not. For some people, it's more frequent than once a year.
Haya, mshasikia. Nendeni, yani fanya kama occasionally, nenda jamani. Or another thing pia, I don't think it's advisable. Manake unajua some of the time, most of the time rather, unasikia a bit of an itch here and there, and then you'd want to buy medication over the counter. Is that advisable when it comes to STIs?
Ideally, it's best you're seen. I know sometimes that's not possible. You don't have the time, you don't have the money to see a doctor. Just make sure you've seen some form of medical professional. Yeah, over the counter is ideally not advisable.
Okay.
Unless, you're very sure what it is. Like, for example, you had this a few weeks ago and your doctor prescribed it and you're like, okay. At least to shikilia you until you get to the doctor's office, so that you're not in complete pain or whatever. But ideally, see a medical professional.
Mshasikia. Alafu sasa mimi nataka chat. Nakuja, najua hauna chat lakini itabidi umeka chat. Nakuja na kwambia nataka number 7.
Mohawk.
I want a mohawk. Utanikia chat daktari.
We'll see. I'll bring up some good pics. Angelina Jolie.
Those are whole rabbit hole. And it's just good vibes. Thank you so much for coming through.
Welcome. Thanks for having me.
Thank you so much for your time. Maybe you could shout out your socials so that watu wajue vizuri watakupata wapi.
So if you're looking for me, my name is Dr. Kristina Sule. My clinic is Alora Medical Practice. It's in Upper Hill. My social media handle is Dr. Kristina_Sule. We also have a clinic page called Alora Medical Practice and have a YouTube channel. It's called Your Free Consult. And you can head over there for OBGYN videos, just to gain clarity. Maybe before do you see your OBGYN, you want to gain some information about something, head on over there. And just reach out to me on text, on DM. I'm pretty accessible.
Yeah, a quick one. To tuck in the labia, how much is that?
It depends on the amount of work to be done. Yes. If you're from certain, there's a range. Maybe there's a lot of work. If you're maybe from a community where they tend to pull the labias and they are very long, so my work is going to be a lot, the cost will differ.
Thank you so much, guys, for tuning in. You can go subscribe to Space Yako, the podcast on YouTube. Subscribe. Share the video, comment. You can also go subscribe to Dr. Kristina Sule's YouTube. Inaitwa Your Free Consult. Go subscribe, ask all your questions. She is pretty accessible. You'll get all your responses to all the kinds of questions that you do have. Also, don't forget to go to our Wazi chatbot, www.wazi, which is WAZZI.ke. Until next time, bye guys.